Welcome to the Thinking Practitioner Podcast,
a podcast where we dig into the fascinating issues, conditions, and quandaries in the massage and manual therapy world today.
I'm Whitney Lowe.
And I'm Til Luchau.
Welcome to the Thinking Practitioner. Books of Discovery has been a part of the massage therapy and bodywork world for over 25 years. Nearly 3,000 schools around the globe teach with their textbooks, e-textbooks, and digital resources. Books of Discovery likes to say learning adventures start here, and they see that same spirit here on the Thinking Practitioner podcast and are proud to support our work, knowing that we share the mission to bring the massage and bodywork community thought-provoking and enlivening content that enhances our profession.
Instructors of manual therapy education programs can request complimentary copies of Books of Discovery's textbooks for review and use in their programs. Listeners like you can explore their collection of learning resources for anatomy, pathology, kinesiology, physiology, ethics, and business mastery at booksofdiscovery.com, where you as a thinking practitioner listener can save 15% by entering thinking at checkout. Thanks for sponsoring us, Books of Discovery. You make all this possible. Whitney, how are you doing?
I'm doing well, sir. How are you doing today?
Also, very good. I missed you last episode. I'm glad to be back with you.
Yes, indeed. Good to be back on stage, and you all had a great discussion, heard, and certainly look forward to hearing all that stuff that came out of it.
Yes. And then today we have an interesting topic in many different ways, both for its content and for its context, its position in our zeitgeist.
Yes.
What are we talking about today, Whitney?
Well, it's time to talk about Vegas, not the gambling Vegas, but the anatomical Vegas.
I thought it was like what stays in the Vegas, or how's that go?
What happens in Vegas stays in Vegas. You know, everybody kind of likes to.
It's not one of those, huh?
Not one of those.
We're talking about the Vegas of the nerve fame.
Yes, Vegas nerve. Yeah.
Well,
so
let's get a little timeline here. When did you first hear about it? Far field.
Yeah, I have to throw a bone out to my outstanding anatomy teacher in massage school, because I know that's the first time I heard about vagus nerve. Do you remember the mnemonic for all the cranial nerves? The one about on old Olympus, tiny tops or something like that?
This is ringing a bell.
Finn and German viewed some hops or something like that. And the V is for the vagus nerve. So vaguely remember that. So
vaguely.
Yeah. So anyway, that's the first time I heard about it, I'm sure, in massage school. But then I do remember, of course, you forget all kinds of stuff you hear then, but I think one of the other times that I began hearing about it that made an impact on me was sometime in the 90s when a lot of popularity with chair massage. And they were having a number of instances of people passing out in massage chairs. And there was a lot of thoughts like, what's happening here? And the primary theory was that this is something that is inducing the vagal response from the increased significant degree of relaxation that people were having. And then that was dropping blood pressure and heart rate to the point that people were passing out.
I first heard about it when I was training as an EMT, about 20 years old. And there was one of our instructors would have us take his pulse and then do a Valsalva maneuver where you just basically blow really hard without letting the air out.
Yeah.
And he would amaze us all by his ability to slow his pulse down.
Oh, wow.
By doing that. And that was basically a vagal response.
Yeah. Now, how did I not know that you had trained as an EMT? I don't remember ever hearing that.
I did it for 2 weeks, and then I was like, this is not for me. Okay. This is not my field. I was so glad to have had that experience, to know, and I was glad to be there for the patients or, people that needed me for those 2 weeks, but that was, I needed a different direction at that point. Yeah. But then I also heard about it a lot at the Rolf Institute in the 90s when actually Stephen Porges was of the Polyvagal fame, who's going to be our guest at some point here in the next few episodes. He was doing some of this initial research on heart rate variability with John Cottingham, who was a Rolfer, and they were actually looking for places they could see differences in heart rate variability. The Rolfers were really interested to see if he could find it in Rolfing. Apparently, Stephen Porges was interested to see what he could find at all. And they did a bunch of studies of heart rate variability and Rolfing, and found like one particular technique that seemed to have a pretty measurable effect on
Yeah.
vagal tone. And that was our pretty much our one piece of hard science evidence for many years. And even now, it turns out the hard science aspect of that is debatable. Everything in hard science is debatable.
Yeah.
Maybe we'll touch on that as we go too.
Yeah. Well, let's start at the basics. So, because this may be something that people need some familiarity, refresher on, or maybe not even really having touched on this a whole lot, because this is deep and out of sight to a lot of us. So, can you give us maybe kind of like a sort of anatomical rundown of vagus? Where is it? What does it do, et cetera? Yeah.
How did I get that question? I should have been asking you this as Mr. Anatomy, but yeah, I'll give my best shot at it. But I should say too, it's deep and out of sight in the body, but in popular culture, it's right out front. I mean, you can't turn on, at least maybe it just has me pegged as a vagal person, the algorithms, because I'm always getting like, stimulate your vagus, turn on your vagus, tone your vagus, do your vagal push-ups today. Do you know about vagal push-ups?
I do not. I'm curious to hear about vagal
This
push-ups.
is,
Like, okay.
people are doing this apparently, gagging themselves with a stick or a pen or something like that, because that gag reflex does give a little spike in vagal activity.
Wow.
And there's the idea that that's good for it. I don't think I'm not recommending that, and I don't even think it's probably good for it. I don't know, but that idea in the popular culture that turning on or stimulating the vagus is a good thing.
Yeah.
There's something to it, but it deserves some nuance.
Yeah. When I was doing some reading prior to our episode here, I did run across some things that were talking about gargling as another means of doing that. And I'm thinking that's maybe a little safer and
maybe a little less dramatic. Right. All right. What is the vagus? The vagus is the primary pathway for parasympathetic signaling out of the brain into the body. And it runs from the brainstem, it's down the neck, right alongside the carotid artery, jugular vein, and then innervates along the way. Branches of it and cousins of it innervate the throat, the motions of the tongue, vocal production, and then very directly it starts to innervate the heart and the viscera below the diaphragm. And I'm sure probably forgetting something, and along that pathway. But it's taking information from those structures and feeding them back to the brain. It's about 80% afferent, meaning 80% of the fibers are sending information from those structures to the brain. The 20% motor or efferent signals are interesting, but again, they may be, for the vocal production, things like that, or there are some visceral functions that it stimulates as well.
Yeah. Also interesting too that there's some branches, and I got thinking about this because this is something that piqued my curiosity a little bit. There are significant branches also to the ear, the various different portions of the ear. And I kind of thinking like there's a lot of acupuncture points and things like that. And there's some like, is it reflexology or some other kinds of methods that focus on treating the ears. And I got thinking like, I wonder if there's a vagal factor there that they're trying to address.
I actually feature the vagal portion of the ear in my headaches workshop.
Oh, okay.
I've seen there's some good evidence of vagal stimulation helping with migraines. People are actually getting vagal stimulators implanted, electrical stimulators or transcutaneous ones. And so I've, for years, experimented with using touch as a way to try to get a similar effect. And the ear and the little patch behind the ear are the only places on the surface of the body that are innervated by the vagus.
Yeah. I heard a story of somebody talking on, this was on a Reddit forum or something like that, of somebody saying they were having some kinds of things where they wanted to try to do something, trying to increase vagal tone, and somebody had told them to stick their finger in their ear and just kind of like, scratch it around or something like that a little bit.
Well, we're putting the cart before the horse a little bit because I want to talk about stimulating the vagus as a concept.
Yeah.
And I'm guilty of the same thing. Like, oh, this must be cool. The vagus is a cool nerve. It regulates a lot of things. And so if we could stimulate it, maybe we can have an effect on some things like migraines or other things like that.
Yeah.
And I think there's a limit to that, and there's some things to know about it, which is why I
Yeah.
was interested in having this conversation.
All right. Well, we'll get to that a little bit more detail here. Before we leave our structure stuff, can you talk a little bit about these divisions between the dorsal and ventral vagus?
This was Stephen Porges in his polyvagal theory, or in other words, he says there's more than one vagal branch, and he divided ventral and dorsal. This is a useful, there's some controversy about it in science. We're going to get him on the show and hear from him directly, but it's still a really useful, you could say, way of talking about it, or way of thinking about it. The ventral vagus is thought to be, in his model, more recent evolutionarily, although that's where some of the arguments happen. But in any case, it connects the face, the throat, the heart, and in his model associated with safety and social engagement. Like when we watch each other's facial expressions or say things, that's that ventral part of the vagus that's modulating that. And that's how it's the nerve of social interaction and connection in that way.
Yeah.
The dorsal vagus is the one that goes subdiaphragmatic, and it's thought to be more simplistically associated with the freeze response or shutting down or that depression aspect.
Yeah.
And it's thought to be more reptilian, again, in that metaphorical evolutionary model. But I should say they're both parasympathetic, if they are indeed anatomical. They're both together. They make a huge part of the parasympathetic structure of the body. And we're interested in the parasympathetic part of the nervous system, for listeners just to review, because that's the relaxation response. That's the counterpoint to the fight or flight stress response that so many of us live in, so many of our clients deal with, and that wears us out eventually. The parasympathetic branch of the autonomic nervous system is the one that's responsible for rest and repair, healing, relaxation.
Yeah. So maybe just briefly too, I mean, most people are familiar with this, but let's just real quickly go over again. Remember, we're talking here about the role predominantly of the autonomic nervous system, and that has these two divisions of the sympathetic and parasympathetic branches. The sympathetic being the one that we most commonly associate with those fight or flight responses. And as you mentioned earlier, the parasympathetic associated with the rest and digest activities. So trying to settle down and just maintain homeostasis of the system, predominantly in the parasympathetic system. And the vagus seems to be the captain in charge of a whole lot of that stuff.
Captain in charge, or maybe it's just a wire. Maybe it's a cable that connects things.
Yeah.
So maybe it's the maybe it's the things that are being transmitted that are in charge. But I think that is actually one of the points of contention. Is the vagus in charge? Probably not. It's probably a wire.
Yeah, because it's a nerve. Yeah.
Yeah.
That makes sense.
Yeah. So that's behind that. Let's stimulate the vagus narrative sometimes. It's not in charge. It's a wire.
Yeah.
And maybe we can have an impact on the wire's function, maybe not, but it's helpful to remember that.
Yeah.
And then here's another one. This is a different episode, but the idea of sympathetic and parasympathetic is a theoretical construct that doesn't have really good correlates in neurology or in function. You start getting down to the details and you realize, wait a minute, this was a theory that was applied to the nervous system in the 20s, and there's lots of exceptions about the ways we name things.
Yeah.
That way. Sometimes we can dig into that rabbit hole if you are interested.
Yeah, this is always interesting. We love divisions and categories and putting things in boxes and models to be able to help it make sense to us. And that's certainly helpful from a mental construct point. But the systems are systems, and they are networked and engaged and enmeshed in so many different ways.
But relaxing is good. And that's what our work does. And so we're interested in things that help people relax. Yeah. And the social part of this is good too, because again, polyvagal theory says that we relax together. We basically feed off of each other's signals, and that helps us calm and regulate our nervous system.
Yeah. Let's talk just a little bit about vagal tone, because this is one of the things that I think is a little bit confusing sometimes, because the idea often is that we're trying to get people to relax and to settle down. And then when you see a lot of the stuff written about vagus, it's talking about ways to increase vagal tone, which might seem a
Yes.
little counterintuitive. So can you kind
Yes.
of pull that apart for us a little?
Yeah. The vagus nerve slows the heart down.
Mhm.
That's its action on the heart. When it has more signal on the vagus nerve, when it's being stimulated, the heart goes slower. The heart has
So
its own.
increased vagal tone is a good thing to turn down activity. So we're trying to.
If turning down the heart is a good thing, then increased
Yeah.
vagal tone is a good thing. Like you said in your chair massage, you can turn down the heart too much and someone can faint.
Right.
And I saw that once in a training situation when I was a student in a class and someone was working on the neck, both sides, and maybe it was blood flow, but probably it was more a vagal response of the person who was sitting up just fell over.
Yeah.
They fainted at that point.
Uh-huh.
And that's probably what Bruce Lee or whoever in the martial arts movies is doing with his fingers when he does his things with the neck. He's probably like knocking out the bad guy with his vagal poke or whatever he does.
Yeah. Yeah, I wonder, well, that certainly probably wasn't the case in the older days because they didn't have that degree of anatomical specificity, but that certainly would make it's an idea. Like I know that from having studied martial arts for so many years, it certainly would help if they studied anatomy in really great detail in martial arts, because I think it would make a lot of what they're doing a whole lot more effective.
Could be. I mean, there's a lot of math. I mean, I have a lot of respect for the teachers I studied with and their anatomical knowledge. Maybe not in the way we think about it in this context, but really amazing knowledge of the body and how touch or blows or whatever locks could affect that.
Yeah.
Yeah.
I do remember a certain number of training activities that I did with some of my teachers that once I learned some more about biomechanics and kinesiology, is like, that's a bad idea.
I see. That's what's behind your comment. I get you. Yeah. I hear you.
Yeah.
All right. We were talking about vagal tone though.
Yeah.
And how the vagus nerve's activity slows down the heart. The heart has its own pacemaker of cells. There's cells that actually keep the heart regulated and keep it beating. And if the vagus nerve wasn't slowing it down, the heart would beat at about 200 beats per minute.
Mm-hmm.
That's the rate of the pacemaker of cells within the heart.
That's amazing.
Yeah. So the vagus is actually the brake that anytime your heart is less than about that rate, it's because the vagus is slowing it down.
Mm-hmm.
So that's the vagal tone idea. Vagal tone is the amount of activity in the vagus nerve. And then heart rate variability is a proxy measure for how effective that is. How much the heart varies is thought to be a sign of how active and effective the vagus is being in slowing the heart down.
Yeah. You know, if you do any kind of digging into discussions about the vagus nerve, you'll hear a lot about this HRV, the heart rate variability, as one of the primary measures. But that also seems like it's not something that's really easy for us as manual therapy practitioners to evaluate, because you really have to be monitoring the heart under lots of circumstances for a longer period of time to see those degrees of variability, right?
Right. And I'm not alone, but I did a bunch of experimentation on myself and a few clients and friends with heart rate variability. We had some cool chest straps. There were some of the first ones that came out that I knew about that helped us measure and watch heart rate variability in real time. And there were so many variables that it's not like pulse. It's not like you can just watch the pulse go up and down and know what's causing it. But it's heart rate variability is affected by so many things that it wasn't always clear why it was going up and down. And when someone was really relaxed, it didn't always translate to a lower heart rate variability measure. So it's a complex averaging you need to do and eliminating a lot of other variables, including like what's in your stomach will change your heart rate variability, the way you're breathing, your overall fitness, how much sleep you got, all that stuff will affect your in the moment heart rate variability measure.
Yeah.
So it's a tricky one to try to actually use in real time. Although there's a bunch of research that says it does correlate with symptoms, especially heart-related symptoms and a bunch of other symptoms.
Yeah. You spoke about breathing. I want to talk about breathing for just a second, because that is another one that's highlighted as critically important or super valuable in trying to help encourage good vagal tone. And then people talk about some other things that might have to do with the exhalation process, humming, singing, chanting, those kinds of things. Tell us a little bit about how does that relate?
Well, breathing does slowing down your breathing, especially lengthening the exhale, does slow your heart rate and increases vagal tone. So if
So
you're
that sensation of like,
a big
that's really a good thing to be doing for our
again,
down the,
if
we're goal
want to be turning down the heart rate, which is, the first question we should ask. But in most cases, yeah, especially if dealing with stress. My dog gives a big vagal breath when he settles on his cushion and finally is ready to sleep. He's just this big old sigh, this big old canine sigh. And that's that vagal spike. That's him going, okay, now I can slow my heart down.
Yeah.
And so being able to do that intentionally excites a lot of people, so to speak. You can really start to think about, like, if I can slow my breathing down. And, this is taught to people dealing with PTSD. It's taught to first responders to control their own fight or flight responses, things like that, to actually just slow the exhale. And there's lots of systems for that.
Yeah.
Basically, it does slow your heart. The mechanism of that is really pretty interesting. That it's, how can I say it in a simple way? Basically, when you exhale, there's a slightly less pressure in your chest, and the heart has to work less hard. So the vagus nerve.
Yeah.
So basically, exhaling, more vagal tone, slower heartbeat, less work needed.
Yeah.
When you inhale, the heart has to really push hard to work against that pressure of the air in your chest cavity too. The vagal tone at that point has less tone and lets the heart beat harder.
Yeah.
So basically, exhaling, more vagal tone, slower heartbeat, less work needed. So you can take advantage of that by just emphasizing the exhale. Spending proportionately more time in the exhale phase means your vagus is active more of your breath cycle. And again, that can result in lower overall heart rate and probably better stress control.
Yeah. I don't recall seeing this in any of this stuff that I was looking over with talking about breathing and vagal tone and things like that. And I'm just curious, I just had this thought as you were talking about this. What about yawning?
Absolutely.
So also doing the same thing?
Yeah, opening up the back of the throat. I mean, the vagus runs right next to the back of the soft palate, and that's what people are poking at when they try to give themselves a vagal push up. But yeah, yawning, absolutely. And there's yogic correlates of opening up the back of the throat, or pranayama breathing, different practices similar to yawning that probably do leverage a lot of vagal effects. But you asked about humming or chanting.
Yeah.
Auricular branch, the one that goes to the ear. So when we're listening to someone to hum along with them, we're activating that. When we synchronize up our tone, we're using the laryngeal vagal branches to modulate the tone. And doing that together, like humming or singing with someone, is a co-regulating activity, and that we have to listen and make sound in harmony with somebody else. That sounds pretty cool to me. That sounds like pretty regulating right there.
So there's a therapeutic correlate for karaoke, maybe?
That's it. That's it. Especially like duet karaoke.
Yeah.
You could say that. Or a sing-along with the audience.
But that might be one of those things that why do we resonate so much with just like a powerful choral presentation, performance or something like that? Like it's more than just the volume, but it's just like all of those voices, that whole idea of entrainment, getting
harmony has lots of meanings there.
Yeah.
Where we start to harmonize and regulate around, we start to tune to the sounds we're hearing and sing along with, you could say. And there was an interesting study, 2011 in the International Journal of Yoga, around Om chanting. Was, it definitely raised the parasympathetic markers.
Yeah.
Had increased emotional regulation there.
Yeah. I'm thinking too about the the multiple frequency harmonic chanting that the Tibetan monks do, the multivocal polyphonic, yes, thank you. The polyphonic chanting, like there may be some interesting things with the fact that two different frequencies are being produced there, overlapping with each other and really causing a greater maybe vibration through the whole channel of the throat that way or something.
It requires a lot of nasal and back of throat control. And just, I mean, if you've ever heard someone in person doing that, it is a powerful nervous system response. Just to listen to someone who's really good at that.
Yeah.
You really feel your own nervous system and training to that.
Yeah. I want to, this was another interesting piece that talked about, again, things that have a tendency to sort of stimulate vagal tone. This one was curious to me, the whole idea of cold exposure, because it seems counterintuitive.
Yeah.
It kind of seems like that's not the way it would go. But
if you got cold exposure, you'd be like fight or flight-ish.
Yeah.
But yeah, it turns out that
generate some heat, move around, do a lot of physical activity or something like that.
This is the diving reflex in particular, I think, is related to vagal tone, where face or neck immersion or cold water stimulates a vagal response that slows the heart rate. And that's the idea that if you fall in the frozen lake, you want to go into shutdown so that you can survive and maybe last longer underwater.
I see.
Maybe I think that's the presumed mechanism behind it. And it's much stronger in babies. Oh yeah, that's where it comes from. Birth. You get your face and head out into the cold world first, and the baby's heart slows way down so it can basically survive that passage process that could take some time.
Yeah.
So everything slows down so it's not using so much oxygen. And I think that's still really strong in kids. I remember back to my EMT days, rescue protocol was different for drowning victims depending on their age, because kids had such a shutdown possibility. They could really just turn everything off from especially a cold water drowning and be resuscitated for much longer times than adults could be.
Yeah. Why do you think that dissipates with age, or why is it that kids are more versatile in that capacity?
Yeah. That's sad to think about, all the things we lose with age.
Yeah.
But that's
our ability to survive in a frozen pond.
That's right. Our memory of being born. Who knows what else we lose? I really don't know. Yeah, that's a good question.
Yeah. So, well, now let's kind of shift gears a little bit and kind of get back to where our audience is.
Sorry. One more thing about cold.
Yeah.
I don't know how many people are using that in their massage and bodywork practices, cold water immersion. But I know people
it's probably not a lot.
Not a lot. Splash your client with cold water in the face.
But it could be. That's the thing. It's like, oh, I heard this on this podcast. I want to try this. I'm going to dump an ice bucket on my client and see how it goes.
But there's a lot of people doing cold water, cold immersion as a way to boost their immune system or do the different things that probably can help with.
Yes,
for sure. And you'll have clients coming in who say, we had one yesterday in our in-house discussion group here. My client says they want me to treat their vagus nerve. Someone told their client that the vagus nerve needed treated, and so she went to her massage therapist to treat it. And what that means is, that was the topic of discussion. Can we treat the vagus nerve?
Yeah.
And should we start to unpack that at all?
I think that's a great question. I'm curious to hear kind of your take on that of can we treat the vagus nerve? So what do you think? Like,
can we treat the vagus nerve? I did pose the question. It depends on what we mean by treat.
Yeah.
If we think of it like a tight muscle where we just massage it and the muscle's not tight anymore and feels better, it's probably not like that with the vagus nerve.
Yeah.
Or again, it's limited by us forgetting that it's a cable and not a thing. It's not a cable and not a control center. It's a wire. It's a transmission pathway, not a regulatory agent to the same extent other things are.
Yeah.
And this idea of treating is complex because that gets pretty quickly into fixing. And then so you identify a problem, you identify the one solution, you apply it, and you expect things to be better. And that thinking itself is problematic, especially when it comes to something as complex as the vagus.
Yeah.
Is thinking about the vagus, knowing the vagus important and an important lever in our work? Absolutely. Are there like magic points you can poke and have your clients be all better? Probably not.
Yeah. I think one of the challenges that we have to grapple with here, like in so many other areas, is people have recognized something interesting from the science that is highly relevant to optimum body function. And that's just, vagal tone. So now a number of therapeutic approaches spring up or sprout up in relation to this idea with some individuals' creative thought about, oh, I'm going to do this and therefore stimulate the vagus nerve. And then they'll put that out there and make a course about it or whatever and get a whole bunch of people following that concept or model before it's ever really been kind of validated that this is actually something that's happening. Because, one of the things that there have been some kind of systematic review studies to try to look at manual therapy, and not just in massage, but, chiropractic and joint mobilizations and all different kinds of manual therapy professions. Is there some trigger target technique, methodology, etc., that can make the vagus nerve work more effectively or efficiently or whatever? And the one thing that's kind of come out of that is that all of these manual therapy systems have a whole lot of things in common with gentle, soothing touch and, trying to encourage relaxation and do all kinds of things that may be systematically working all together to help improve or increase vagal tone, but it's not like it's not the vagus technique. It's not this one technique that does something specific to these tissues that make it work.
The interaction we have with our clients is a very powerful vagal stimulator.
Back to your discussion of the ventral,
let's say,
branch,
we want to narrow it down to a place or a branch or something anatomical. We're probably, through the context, through the way we talk to our clients, their enjoyment of our company or the table quality or the ways our sheets smell or all those kind of things have a big influence on vagal tone. More than us trying to touch the vagus nerve. Think about it again. If we think about it like a nerve, someone comes in with sciatic pain. There are a different kind of nerve, a different nerve rather. There are some things we could do directly by touching the sciatic nerve that might help, but that's really a skilled intervention. You have to be not only very specific, but have a very specific kind of touch, a very listening touch that helps with maybe some glide or mobilization or calming down. You don't calm the sciatic nerve down by just poking it.
Or rubbing it,
or even trying to stretch it.
Right.
So if we translate that to the vagus nerve, another nerve, it's like, there's lots of techniques. You'll see where people digging into the neck, trying to rub their their vagus nerve, or they look for ways to work deep in the belly, like some deep belly work is trying to stimulate vagal nerve. I don't know if that's the way we want to go about it necessarily.
I think this is a really valid point when you, some of the discussions around various different approaches seem to be saying too, there's a lot of indirect methods that are probably occurring. For example, things such as, mechanoreceptors in certain tissues or tensions through maybe fascial networks or things like that might have an influence. Like some of the excess afferent signaling from mechanoreceptors may, be picked up by a lot of the sensory receptors and through those very, very substantial sensory afferent fibers in the vagus nerve. And that may be what's really making the difference. Not that we're doing something to the vagus nerve, but like it's got really good sensory apparatus that picks up on all kinds of things, and it's helping transmit a whole bunch of information. But then you kind of go back to thinking, at least I do anyway, thinking like, if what you're saying is true, which I really think the vagus is really the wire, that means that all that stuff is going into somewhere, getting processed, and then there's a response after that point. Not that the vagus is making the response itself.
And it's, we're back to, let me say something about that. Right. It's the transmission mechanism. There are things going on in the nerve that are interesting, but it's the transmission mechanism. And we want to influence what the source of that signal is and where that signal is processed more than we want to try to influence the wire that's transmitting the signal. The source being, say, the belly or the viscera or the throat. Those are the sources of that afferent information that's going to the brain. And then there's the brain. And we have a lot of effects on the brain through context, through the ways that we're helping people think about things, the experiences we have. Those are really powerful levers toward the thing that we're trying to get to with vagal response. But now, sorry, I should just give a shout out to Fabiana Silva, who was our guest back in 142, was talking about fascia and the vagus nerve, and she was saying, yeah, the physical context of that wire of the vagus nerve is important too, and there may be properties of the fascia or pathways that could help that vagus work better or worse through different density, compression, or sliding issues. That's not unreasonable, I don't think, either. But I think that's a much more powerful lever to think again about what the ultimate goal we want is, which is relaxation, regulation, connection. And there's very powerful ways to do that don't involve just trying to poke the vagus nerve.
Let me just backtrack a little bit here too, in terms of, kind of back to what you said of the person saying that a client came in and said that they needed to have some work on their vagus nerve.
Yeah.
How would we as practitioners know, or what would be the factors that would make us think we need to help encourage, better vagal tone with somebody? What is it that would make us think that? Is it maybe just somebody saying that they're wound up and stressed out, or what kind of things would lead us in that direction, do you think?
I don't draw that conclusion. Because it's just one measure and it's a complicated measure. I don't think, oh, this person needs better vagal tone. I think, they're stressed out, or they're having autoimmune issues or systemic inflammatory issues. All those are affected by vagal tone too. Or they're having migraines, or they have a seizure history, or there's a lot of conditions that relate to immune or autoimmune or inflammatory reactions that the vagus does actually help modulate. We didn't even mention inflammation yet.
Yeah, I was just getting ready to say, I know you've done a lot of deep dive onto that. Can you expound on that a little bit, the whole relationship of vagus and inflammatory stuff?
Yeah, the vagus has direct effects on the tissues around the gut in an anti-inflammatory way. It actually does release agents, inflammatory resolution agents that help calm down inflammation in the gut. And it's monitoring the inflammatory reactions of those tissues and telling the brain, listen, there's something in my gut that's actually inflammatory to a mild or great extent, and we need to be a little more vigilant, perhaps. So it's got it basically helps the systemic immune system turn down overall systemic inflammation, but it helps it monitor it and control it. So it has a powerful effect there, which is another reason a lot of people are trying to stimulate it.
Yeah.
But it's one lever to turn down inflammation. It's a little bit like you're driving your car and you're going too fast. And so you think the problem is your speedometer cable. The problem is you're going too fast.
Yeah.
It isn't the transmission route of that information to your brain.
Yeah.
And in this case, the speedometer cable, the vagus nerve, does actually help your brain monitor what's happening and turn it down. But it's not the main lever. It's a hack that we don't even know the long-term effects of. There's a lot of interesting vagal stimulation happening electrically or transcutaneously for these conditions, but they're 10 years old at the most, maybe 15 at the very, very most in research settings. And we don't know what it's like to try to use the speedometer cable to turn down the car speed for that long.
Yeah. Yeah. Interesting metaphor there. And
that's a good one, but that's the best way I have of trying to describe it. It's important, but it's not the cause. It's more the signaler.
Yeah. And, we've spoken on the podcast a good bit of both you and I of changes in our own thought processes over the years around what is our manual therapy actually doing. And this is another one of those instances. I think for me, it's thinking less about direct specific effects to a target tissue or target structure and more about the overall generalized approaches that may seem to be gaining potential benefits in the long term.
Fewer magic bullets, greater overall skill in the interaction and in our including our touch interactions.
Yeah.
That's what is the context for the change we get. But I think I want to go back to your question because it was a really good one. What would a client present with that would make me think of the vagus? It is stress, and it is autoimmune things, and it is inflammatory reactions, and it is sometimes like local arthritis, all those things. The vagus can be a lever for helping with those things. But I affect the vagus, again, through the context and through maybe some breathing. Maybe I talk to them differently, and maybe I get them to hum along with me, maybe, if we're being playful and trying things out. So yeah, the vagus is one pathway, but it's it's one of the pathways,
Yeah.
and it's the means to the end, and the end is a happier client getting more what they want.
Right. And that kind of like it taps into also something I tell my students this a lot is I think it's important for us to remember that when you are in the treatment room with your clients, you are really doing two distinct things, and we focus predominantly on one of them, and that is being a clinician, doing specific work with them and treating their body with your manual therapy techniques. But the other thing that we do is we are an educator. And this is one of those places where what you might be able to share with them or teach them about various different things that will help outside the treatment room could be just as valuable and really important for them when they get home and are trying to find other ways to settle down the detrimental effects of whatever it is that's going on in their life causing these challenges that they don't have access to massage 24 hours a day, of course, but they do have access to breathing, and that is something that they could do. They do have access to humming in most places if you can't, not in a library, probably. Okay.
Yeah.
You know,
Joining a community choir.
yeah.
Or whatever. There's lots of ways to leverage vagal effects
Yeah.
and help, and certainly increasing awareness of that in the culture as a whole is a good thing.
Yeah.
It's the reason for me wanting to do this episode was to talk about the oversimplification potential there.
Yeah.
And I do, I'm back to your question again. Someone comes in with a migraine, I'll work inside their ear, for goodness sake. But that's just one of the places I work. And there's some really interesting research around inflammatory markers and work inside the ear with a vibrator. This is people with MS that were in this study. So they had elevated autoimmune activity and cytokines, markers of that activity. And they did a study where they put a little mini vibrator inside these people's ear for 10 minutes. And people had a reduction in the cytokine levels that lasted for a week.
Wow.
So that's talk about magic bullets. That sounds pretty promising.
Yeah.
And it took 10 minutes.
Mm-hmm.
And it was one marker. And so, sure, if you want to work inside someone's ear for 10 minutes, please. Someone with a migraine is going to love that.
Yeah.
But no, that's just, again, one specific intervention and what may be a bigger conversation, bigger process that someone needs to engage in.
And I know a little bit difficult for us to do on an audio podcast, but can you just give any kind of brief discussion of when you talk about working inside somebody's ear? That's an unusual thing for us, especially because of the body cavity.
You're going to ask me to describe where and how. We are such practical people, us bodyworkers.
Yes.
We want to know what to touch and how to touch it, and that's good. I want to answer that question, but I just want to point out that, again, that's where we take every question. Okay, great. Now, how do I touch it?
Yeah.
And
well, one of the reasons that I want to say is I want to also make sure we cover how do you not do this? Like you're not taking that pin and poking somebody's eardrum out.
Trying to get a gag reflex in the ear. No. But I do want to bookmark that tendency we have, and I have it too, to want to reduce things to their physical component that I can touch. That's really good, but it's not the whole story, and thinking bigger can help us. Yeah. That said, it's the deepest part of the ear, the concha, the concha, the simba, the deepest folds of the ear, not the hole, not the meatus, the external meatus, not that hole, but the little bowl right above that hole, the deepest fissure or the deepest bowl of the ear, which has the most direct vagal innervation. That and a little patch of skin right behind the ear on the scalp.
Okay. So when you say the deepest bowl of the ear, just again clarifying for our listeners here, you're talking about the outer ear, not the deepest bowl. And you said not in the meatus, not in the internal hole into your head, but you're on the outer portion of the ear.
Not sticking my finger inside their ear hole, but the external ear. Yeah. The deepest part of the external ear. That's right.
You know, I remember when I was in massage school and they were teaching us how to do a general relaxation massage, and they were saying like, oh, a nice way to finish off your massage is grab somebody's ears and, pull them up and pull them in all different directions. I thought like, that's kind of weird, isn't it? But it feels good.
It feels awesome.
Yeah.
Amazing. Yeah.
Right. So
someone's can make friends with me really quick, I guess in the right context, on the massage table, like working my ears.
Yeah.
Yeah. I guess, we call it the headmaster technique, because in the wrong context, it's also pretty alarming.
Yeah.
Have someone grab you by your ear and pull you around.
All right, because somebody did that to you as a little kid or whatever. It's like, get over here, you little twerp.
That's right.
Yeah.
But no, it's the ears are profoundly relaxing, and probably the vagal connection is a big part of that.
Yeah. Now, we were also going to talk a bit more about polyvagal theory. We did touch base on that earlier. Did we kind of get the main?
I should just say, yeah, I think we did, but I should just say it's widely used. It's had a big influence on trauma therapy and trauma awareness and trauma informed work. And we're going to talk to Stephen Porges soon here, I hope. And so I'm going to let him do a better job of telling us about it. But briefly, it gave a lot of us some kind of scientific map for understanding the effects we were having with both our touch and the importance of the interaction. So it gave us a map for that. It is criticized in some circles for a lack of research basis, maybe, or especially around the evolutionary model is probably not agreed upon in all circles. Maybe it's more metaphorical than actual. And then some of the anatomy involved gets argued about, but basically it's a really influential model that's really useful and has been a big influence on my thinking as well. Yeah. So that's the brief introduction, and I'm looking forward to hearing from Stephen Porges himself here.
Yeah, good. So one of the other things that we kind of talked about, maybe we should touch base on, and you had alluded to this earlier too, some claims that we've heard or seen people make around Vegas stuff, or anything in particular come to mind for you of things that you've heard around just vagal stuff?
Well, just turning on my vagus, stimulating my vagus. Yeah, you don't say I turn on my brake pedal.
Yeah.
Back to the car analogy. The vagus is the brake pedal of the heart.
Yeah.
And so it's the modulation, you could say, or it's the control or the nuance, or a little bit of that, a little more, a little less of that, that's important. Not just a big pump on the brake.
Yeah, right.
So
exactly.
That's maybe the nuance that's important to keep in mind, that it's always working. Your heart would be beating at 200 beats a minute if it wasn't working. And we want it to be effective. We want it to be not fighting too much other stressors, so that it doesn't have to be pumping the brake so hard. And we want your whole system to be healthy, not just to push harder on the brake.
Yeah. I want to hear a little bit more, just kind of, and I'm curious about this, at least maybe you can sort of shed a little more light on. You said that the heart would be beating so much faster if it wasn't for the vagus.
Yeah.
What is it that makes the heart beat so much faster ordinarily? Like, I mean, it seems like at that rate, you would think that muscle would tire out a whole lot faster earlier in our life.
As I understand it, and I owe, thanks to Mary Frances O'Connor in her book about this. She lays out in pretty clear detail, as only she can do, that the pacemakers, cells that are within the heart that tell the heart it should be beating, they generate the impulses that the heart uses to beat from, are firing at 200 beats a minute.
Yeah, interesting.
And it's the vagus. The only reason it's slower is because the vagus is slowing that down. That's what the vagus nerve does.
Yeah, makes me curious and wonder about this. I'm doing all this stuff all the time with bird rehab because of my wife being a wildlife rehabilitator, and one of the things that we were talking about a lot during the summertime, during season with hummingbirds, is their heart rate. It's incredibly fast. It's something like, I don't even remember, 800 beats a minute or 1,000 beats a minute or something like that. It's incredibly fast. And just like, are they absent of vagus, or is it just like irrelevant for them or something like that? I don't know what
This is birds in general, or birds when...
This is hummingbirds in particular.
Hummingbirds. Oh, my goodness. Yeah, I can imagine that.
Yeah.
Wow.
And the wing beat rate is extremely high also for them. But
sure.
Yeah, that's just remarkable to think about muscles getting a stimulus to contract that fast, that many times for so long, particularly difficult.
Yep. That's great. That's really a fascinating fact. Something that those little hummingbird hearts are beating so quickly.
Yeah.
Shall we finish it up with some key points?
Yeah, let's do. Yeah. So what are some of those key things that we want to zero in on?
If we want to learn from the vagus, we can really use its properties or its power by incorporating slow breathing. We're slowing people's breath down or having people exhale slowly. We can use our voice. We can understand that our voice is a tool. Its tone, its pace, its rhythm, that helps someone's brain and nervous system calm down too.
Uh-huh.
And a lot of it's the client's safety and connection they have with this. That's where the vagus really comes online, and that's the biggest influence we have on the vagus.
The client safety, again, we've sort of talked about this on other episodes, the context of what we create, of that in that environment of safety and trust and support and everything that we're doing with our clients, immeasurably important.
Mm-hmm. That's the context that it happens in.
Yeah.
All right. Thanks for the conversation today, Whitney.
Indeed. Always fascinating to get into some of these kinds of things. And again, I think, looking into these things, we see there's still a lot left to learn here, a lot that we're exploring. And there's, as you noted, a number of theoretical models out there and some theories around vagus stuff that may turn out to be not as accurate as we initially think with the things, but that's science and that's progress, as it continue to refine our understanding over time.
Yeah, right. Accuracy is important.
Yeah.
And the exciting part of the metaphor is the real story here. Why do people get so excited by the vagus nerve? It has that promise of doing amazing things.
Yeah.
And amazing things are possible. I don't want to say that. I'd say let's really get clear about what is causing those amazing things and what our levers are for amazing things to happen.
I was thinking about this a little bit. Do you think that there's any kind of similarity? We kind of touched base on this a little bit with that episode. I don't remember the number right off the top of my head, the episode that we did on the psoas.
Yeah.
Of it having this mystique around it, of mysteriousness, because again, not so easily visible, deeper down in the abdomen, but significant, having to do with lots of different things. And maybe there's some correlation there with why there's such fascination
Totally.
with the vagus.
Yeah, they occupy a similar slot in our collective psyche, don't they?
Yeah.
These mysterious, powerful, hidden things that are the key to a lot of important things. And maybe that gets oversimplified or overblown, but still great to know about and incorporate in our work.
Yeah.
Cool.
So,
Well, should I thank our sponsors?
Let's do it.
The Thinking Practitioner podcast is proudly supported by ABMP, Associated Bodywork and Massage Professionals, the premier association for dedicated massage and bodywork practitioners like you. When you join ABMP, you're not just getting industry-leading liability insurance, you're gaining practical resources designed to support your career. From free top-tier continuing education and quick reference apps like Pocket Pathology and 5-Minute Muscles, ABMP equips you with the tools you need to succeed and grow your practice.
And ABMP is committed to elevating the profession with expert voices, fresh perspectives, and invaluable insights through continuing education courses, the ABMP podcast, and Massage and Bodywork magazine, featuring industry leaders like my partner Til and myself, Whitney, and thinking practitioner listeners like you can get exclusive savings on ABMP membership at abmp.com/thinking. So join the best and expect more from your professional association. Would like to say thanks to all of our listeners and to our sponsors. You can stop by our sites for the video show notes, transcripts, and any extras. You can find that over on my site at academyofclinicalmassage.com. And Til, for you, where can people find you there?
My site is advanced-trainings.com, and we want to hear from you listeners with your ideas, your feedback, your input about the show. Just email us at info@thethinkingpractitioner.com. Comment on a episode in your podcast player, or look for us on social media and YouTube. I am at Til Luchau, my name. That's how you find me. Whitney, where can people find you?
Also on social under my name, Whitney Lowe. And we'd really appreciate it if you would rate us on Spotify or Apple Podcasts or wherever it is that you happen to listen. It really does help other people find the show and keeps us going here. So please take a few seconds to do that. And thanks, as always, for sharing the word and telling a friend to get it out there. And we'll look forward to seeing you again. And before we leave today, one deep, good exhalations.
Lovely. Thanks, Freddie.